So, it's now allergy season, and, well, I should say it's allergy season for me. The problem that I hate or despise is when I'm seeing patients and I have a drippy nose, and I might clear it before I enter the room, but somewhere along the line in my interviewing process of the usual 15 minutes during a immediate care visit, the nose will start running, and it becomes distracting. And then I kind of lose focus on what the patient's saying, where I'm going, so I either have to start snorting the snot up, the drippiness, or excuse myself, blow, go outside, and come back in. So either way, allergies for anyone, a runny nose for anyone, is irritating. And I have a previous video on stuffy nose, which tells you about eustachian tube dysfunction, but this video is mostly for what to do with possible allergies. If you have a fever, it's not allergies anymore. If it's the usual time of year, if it's, say, a new basement, if it's the first year that you've ever been in your job or your new house, and it's the first season of whether it's summer, spring, fall, or winter, if you're having the symptoms, it might be worth it to squash the symptoms and then wait till next season to see if there's a recurrence. Otherwise, I don't know if I would do the big workup on checking for mold, checking for blood testing for fancy allergens. I'd probably, if it's the first time around, I'd take care of as many symptoms of allergy as possible. That usually means, number one, calming down the body. And I'll go through a couple of easy things. Most important is to stay hydrated. I think that most people, when I see folks that come in for urine testing or drug testing before employment, they can't pee. And a quarter of that's because they are probably bladder shy, but the other 3/4 is because they just don't hydrate enough. Hydration is important. If you're exposed to allergen, whether you inhale it, whether you eat it, whether you breathe it in, if you have enough fluids, the body can secrete liquid, mucus, to get rid of the allergen and have you blow it out. If you don't have enough fluids in you, then the allergen stays in you, and it becomes a long-term problem. So staying hydrated is important. I think magnesium is really important. I just happen to have a lot of Now products because it's down the street from me. But magnesium, I don't like oxide or caltrate. I like magnesium glycinate, magnesium aspartate. I think magnesium, because of its properties on relaxation, relaxes bronchial airways. It can relax, I think, even anxiety, helps with sleep. But I think magnesium, because most Americans are kind of low on it, and it's very expensive and hard to check magnesium levels in the blood, unless you do an RBC magnesium level, which is usually not paid for. It's not worth it. Just have to make sure your kidneys are functioning okay, and then you start on standard doses of magnesium. You'll know when you take too much magnesium, you have diarrhea. So that's gonna. But that's a good possibility if you're constipated or you suffer from constipation. The magnesium will help. Anyway, that's another thing. Really important. You have to get moisturized tissues. Puffs Plus, Kleenex with moisturizer. Although when you clean your glasses by mistake, it gets it all smudgy. It'll help with the irritation of the nose. It's so important. After a couple of days, you'll start to irritate, and it'll burn when you wash your face. It'll burn when you wipe your nose. So it is important. I like essential oils at all times. I was taught by aromatherapist in Claremont, Florida, Jen from Jen Sense, and this is actually one of her products that she has. It is a blend. It's an oil carrier oil with several different oils in it, but having lavender is a calming oil to have either placed on your body, placed on your pillow, or to inhale it in the room. I have a vaporizer, ultrasonic nebulizer in this area, and it perfuses this area with calming oil. So sometimes even eucalyptus also helps to decrease swelling in the nose, open up bronchial airways. I think both of these are great. So lavender, eucalyptus, depending on your preference. A friend of mine who also graduated from the Arizona Center for Integrative Medicine put together this book. Let's see if you can focus in on this. And it's a good guide as far as Elizabeth Smoots, she's in my class. Good guide as far as what to do with allergies if you're unsure. And I think it's worth it to read through. some of the basics. If you've done all that and you're still having problems with a drippy nose, itchy eyes in the morning, wake up in the middle of the night and you're just itchy, say when the heater kicks on, 4 or 5 in the morning, then you have to bite the bullet and start taking some things to help calm down your body's allergic response. Most of the allergic response is due to mast cell stimulation. There's these little guys that are responsible for circulating around the bloodstream and looking for a fight. If they find anything that's dangerous, poison ivy, bee sting, poison venom, latex in some people, they'll go to the area and release a whole bunch of chemotactic factors in the bloodstream to call in more mast cells, and you have this massive response. So sometimes if you do things to calm the mast cells down, it'll help. Now, some of the natural things to consider are echinacea. This is an echinacea spray it helps with the sore throat. You get sore throats from postnasal drip. If the nose is constantly putting out fluid to engulf an allergen, let's just think of a dust particle or ragweed particle. If one of those things, microscopic, gets sucked into the nose from an inhale or passing by a dirty vent in your house or in the office, well, it causes an irritation to the lining of the nose. The lining of the nose starts to secrete, first it starts to swell, and then the mast cells release and start to secrete fluid, snot essentially, clear usually. And then you start to drip it out. You'll either drip it forward or you'll drip it back. I always say that my kids, if you're having a lot of nasal discharge, whether you're obstructed or just partially obstructed, you really should kick it out, because the more we swallow it, the more it turns into something that's going to be bad for the GI tract. Usually it ends up in diarrhea. You swallow a pound of phlegm, it's got to go somewhere, and it results in bowel movements that'll be gassy and foul smelling. So spit it out. If you can't spit it out, then get more fluid in or expose yourself to steam. I think a steam cave is really important. Then you can go back to using the lavender or the eucalyptus or maybe even peppermint limitedly in the steam cave. That's when you steam up a pot of water and you cover yourself safely with a towel and you just breathe in the steam. Sometimes when you steam enough, it will liquefy any snot that's hard, or it'll help liquefy any allergens that are still stuck on the lining, and you can then blow them out. It's great for kids because kids sometimes have a hard time blowing out snot. I think that on a regular basis is important. I usually use a neti pot, as you would have seen in the video that I have on stuffy nose. But some people don't like neti pots. You can do nasal saline, you can do steam. Whatever you do, you have to try to mechanically irrigate the crap out of your nose, especially when you're exposed to something. So echinacea, very good for relaxing mast cells, helping decrease the allergic response. This has a couple other things in it, but it helps with getting the echinacea into you and also soothing the body. It has peppermint too. I think essential oil, I think omega-3 fish oil or olive oil is also good. The way I present is more of a postnasal drip, and it hurts. As long as there's no sore throat from pharyngitis, strep throat, a bacterial infection of the tonsils, and it's just postnasal drip, then I'll start spraying olive leaf extract for soothing. And then you have the essence of the olive. It'll also help with fighting infection if it's coming, or calming down the cells. Sometimes we'll get into strong botanicals. Quercetin, this is called Resperol. It's by Now Foods, but specifically in this is quercetin. Quercetin is actually used in some areas of the world as an antibiotic. It has some properties in some limited studies to fight infection, but it also calms down the allergic response. And you think of what usually happens to allergic response: stuffy nose, itchy eyes, a little bit of a cough, and then itching or irritation. So quercetin 3 times a day, sometimes 4 times a day, very good, but you have to check the product brand name to make sure you're comfortable with them. Sometimes if you're unsure, then you can go to consumerlabs.com and they probably would have tested it. I like nasal crom. After clearing out the nostrils, clearing out the snot for the short time that you can get a clear nostril, till the mucus starts to build up again, spraying with nasal crom, which is ipratropium bromide. It used to be prescription. Now this is technically an ex-prescription medicine, now over the counter, but it originates from more of a plant-based healing. The technical name is ipratropium bromide. works to decrease the amount of fluid that's secreted by respiratory lining of the nose, the throat, the chest, the lungs. And it works great because it is not addictive like oxymetazoline or Afrin, and it's not a steroid, so it works to mechanically dry up things. The one caveat, you can use this 4 times a day. I usually say in peak allergy season you use it 4 times a day after you irrigate with neti pot, saline, or steam cave. You can get a bloody nose because it dries up so effectively. But also important, especially if you're seeing patients or in the public eye and you don't want a drip to start in your 30-minute conversation with people. Although high in sugar, you can get some Ricola that has echinacea in it, sometimes it has some herb in it. I think this helps with keeping the throat not so sore, in addition to the olive leaf extract spray. I like these to remind myself I have to still be doing something on a regular basis. So if we can't get response with the team, and if you look in Elizabeth's book, there's other herbs that you can sometimes rely on. Then we go to the prescriptions, or the stronger over-the-counter antihistamines. Benadryl, even in generic form, or Waldron. Benadryl is great, but it makes you sleepy. You can do Benadryl up to 50 milligrams, 50, every 6 hours, but it can make you sleepy, and that could potentially cause problems with people who work in factories or drive for a living. But it does work. It knocks you out. It might dry you up at the same time, but it'll knock you out. There are non-sedating antihistamines. Zyrtec's my favorite. Claritin's out there. Allegra. But Zyrtec's my favorite. I like Zyrtec once a day dosing. I usually keep this in the car if I need it. I have had some allergy specialists double the dose, go higher than suggested, even use Zyrtec in the daytime and Benadryl at night. That's a lot of antihistamine. If you're suffering, you might need it, but you can definitely have to be careful about falling asleep. Even when you take the Zyrtec, which is non-sedating, when you combine that with another antihistamine, it can make you very tired. If you're very sensitive to antihistamines, you can go with children's antihistamine. Triaminic nighttime and Triaminic multi-symptom, these are for kids, but they do have, because they're liquids, you have a amount of antihistamine that you can control how much you get. You can take kids' dose if you're very sensitive to medicines, like some of my fibromyalgia sufferers. Take half a teaspoon to a teaspoon. It's not that much, but it'll be just enough antihistamine to maybe work with you and stop the itchy eyes, the stuffy nose, the cough. So both of these are great. They can make you sleepy still, just like the Benadryl or the Zyrtecs, but you can you can change the titer of how much you're getting, and they're grape flavored. Worst comes to worst when my allergy sufferers are really irritated. That's what happens. Dry skin makes you irritated. The itchy eyes, the constant drip, it actually will affect your mood eventually. Sometimes I have people that are on fire. Skull cap and kava kava temporarily are nice 3 times a day, one or the other, to help calm the mood down. It'll help you tolerate the allergy side effects and the allergy symptoms. I should say the allergy medicine side effects and the symptoms of the allergy itself. Help you calm that down, might be able to get some sleep. Kava kava has been linked to some liver problems. Skull cap, haven't seen any bad side effects or any bad research on it, but usually it's 3 times a day in a dropper form. The most important thing too is you got to clean up. I like using the spray on, as long as the CFCs aren't too bad. Spray on dusting where you wipe it wet off. You always have to wear a mask and get the masks that are sealed, like this one. I don't like the masks that are just around the ear. This has a great seal, front and back, and it has a lid that you can pull over. This is what we use for Ebola, just in case it comes into the immediate care center. But you use the mask while you're dusting, and you have to dust twice a week while your allergy season's bad. Pledge is great, it has some waxes in it. You don't forget, you also have to vacuum, hopefully with a HEPA filter vacuum twice a week as well. Even if you don't see dust, I'd still vacuum. Even if you don't have carpet, I'd still wipe down or vacuum the floor. This is important. You always have to consider getting an allergen-tested air filter for the furnace. If it's summer, then you'll probably need it. Well, it doesn't matter which season. Sometimes changing to the more expensive filter would be important. Now these are cheap now, so they used to be 20 to 30 bucks, but now you can find them cheap. They just are, they have a thicker paper that lines the filter. So it supposedly will catch even the smallest micron of allergen. The final thing to suggest is that even if you're not allergic to gluten or wheat or dairy during the season, or even if you've been tested and they found that you're not allergic to it, I think those are irritants. I think the United States diet is way too heavy in dairy and wheat or gluten. So my suggestion is, if you've done all that stuff I just mentioned and you're still having problems with allergies, abstain. Abstain from, this is dairy. This is yogurt, which is healthy because of some people thinking it's a probiotic, but it has dairy in it. Even if it's non-fat dairy, it's still dairy. There's a protein that comes from cow that you can't take out when you try to pasteurize this or change it into cheese or yogurt or sell it as lactose-free milk. There's still a protein that can, in some people, cause irritation. And I think you have enough irritants already in your environment and probably in some of the chemicals you're eating and preservatives and perfumes that one extra thing ain't gonna help. I love bread, but sometimes you might have to switch off for during the season, gluten-free or wheat-free. There's a lot of substitutes. You have to be creative with what you do with your, say, rice or quinoa substitutes. But again, you'll have to get to the right nutritionist and or the right naturopath, or just attend a couple of classes at Whole Foods or Fruit for Yield and figure out how to cook and prepare things with dairy-free, gluten-free, or wheat-free time periods. And then when allergy season's done and you can let up on some of these herbs and medicines, then you can go back to eating the other foods. I would usually stay away. But you'll find, most people will find that they like to stay back away because they're so healthy at that point. So that's my usual go-to practice. If all else fails, hey, if you need to be on steroids, then that's pretty aggressive. I can open up the nose and take care of all the swelling with a short burst of steroids, but at that point in time, probably should be seeing an ENT specialist just to see why exactly you keep on breaking through all this stuff. And if you haven't tried all this stuff, again, start with education on your own. I wouldn't go straight to getting the skin test. That's called RAS testing. Blood test is more accurate, truthfully, because the skin test, it still depends on somebody to read it. So the only problem is the blood test, it might not be covered. And then once you get the blood test, what do? You're going to eliminate everything? Well, you should have been doing that anyway. You still have to calm down the mast cells, clean up the environment, and calm down the body. So read Elizabeth's book. It is pretty good. It'll empower you with information, and hopefully you'll make it through the season and then prepare for the next season.